Well, many things have changed since the COVID-19 pandemic started, but will these changes continue to be a part of our lives? That is the question we all have. Well, Dr. Kohli spoke with Danny about the pandemic and if we need to start calling it an endemic.
Dr. Kohli, it's great to see you again. You know, we've been flip-flopping. We've been at home and then back in person and then back at home. And I think a lot of us are looking forward to the pandemic kind of coming to an end. So we're several years into this pandemic at this point. Will the COVID-19 pandemic end up being an endemic? What do you think?
So, Nanny, a pandemic means uncontrolled spread occurring across multiple areas. Endemic means more like we have control. We had initially hoped to completely eradicate the coronavirus and not have to deal with it at all. I think that's not going to happen at this point, but I do have strong hope that it's going to become endemic, just like we have the flu, we have other cold viruses, and so it may be something that we have to deal with. But I am very optimistic that this big Omicron surge that we just had may help us make that transition a little bit faster, where it helps us to control the spread of the infection a little bit easier.
Okay, well, I think, a big thing for us is the transition from different, ways of looking at the pandemic and different variants with COVID-19, I think can be really tricky for a lot of us. So how do we continue to respect the virus, but also be safe with, living our lives and getting back out there?
This virus has been one step ahead of us every single time. So I have tremendous respect for this virus. And I think we all really need to make sure that even as the cases and the positivity numbers continue to go down, we don't prematurely let our guard down, because we know that we haven't completely won the battle yet. And we are just a stone's throw away from yet another variant, which could possibly evade our immune system, evade our vaccines, evade the antibody response that we have. So personally, what I'm recommending people, and I'm doing, is to continue to follow many of those mitigation measures. So if I'm in a crowded public space, I still put on masks. If I'm with a bunch of people whose vaccination status I don't know, or I don't know if they may have been exposed, I put my mask on. I think it's reasonable for us to start to go out and get our lives back to normal, go to restaurants and do things like that, but not in the same way where we don't have to think about masks and washing our hands.
Okay. And would you say that that's the same for things like social distancing or any other daily changes to protect ourselves and others?
Very much so. And now we know Omicron is substantially more contagious than previous variants, so that social distancing piece gets even more amplified, because that 6 feet potentially may not even be enough, as we had initially thought for the initial variant. So I really kind of feel like we have all these tools in our toolbox, these mitigation measures like wearing masks, washing our hands, keeping our distance, wiping down the surfaces. We've learned a lot of great things in the last couple of years, and I hope that we continue to do those even as this virus becomes more endemic.
Definitely. Well, what's the best way to protect ourselves and our family? It sounds like getting vaccinated is pretty important.
Very important. And as we get the next generation of vaccines, and I'm hopeful that that'll come, in March or April, because the companies are looking at Omicron specific vaccines, it's going to become even more critical that we give our immune system that boost again with those Omicron specific vaccines, because we know that antibody responses to previous boosters can go away in as soon as 10 weeks. So it's really important, if you haven't yet been vaccinated, to get out there and get it. If you've already been vaccinated and boosted, when it's the right time and it's been FDA approved, to get that Omicron specific vaccine. And 9Health 365 is offering vaccinations at many of its sites. And so maybe go to the website, check it out, figure out where you can get your vaccine.
Excellent. Dr. Kohli, thank you so much for always coming in and making sure that we're staying healthy with all of these ever-changing rules and everything that's going on. It's nice to know that we have you to keep us straight. We appreciate it.
As always, affordable preventative health screenings are available from 9Health 365 at upcoming 9Health fairs or at a local Quest Diagnostic Center. You can learn more now at 9health365.org.